Dr. Ferrer, we're live. You may begin.
Good evening, everyone, and thanks so much for joining us for this virtual town hall on the post-fire impacts affecting schools and families in the Altadena and Pasadena communities. I want to begin by expressing my deep gratitude to Supervisor Catherine Barger for her leadership and dedication to supporting the wildfire-affected communities and to supporting our department and other county departments in our response activities as well. I also want to really thank all of the residents and the workers in Pasadena and Altadena. You've been through so much. We're here to support you. And I know that these have been two very, very challenging months. So please reach out. Let us know what else we can be doing to help because that's really our primary responsibility. Be as helpful and supportive as we can, helping you on this recovery journey. I do want to also thank the Pasadena Health Department, the Pasadena Unified School District, the California Department of Public Health, our many school partners, and the countless parents who have played an active role in ensuring that schools are able to open and recovery efforts are informed by the needs of students and families. Your collaboration has been essential in this process, and we're tremendously grateful for the partnership. I know that many of you joined us tonight because you have concerns about the schools, the community, and the impact of the fires on the health and well-being of your families. And I also know it's hard in the aftermath of the fires to know where to begin. Wildfires create not only immediate danger, but lingering concerns about air quality, water safety, and environmental hazards, especially in spaces where children spend much of their day. I want to go to the first slide. I do want to just take a moment to talk a little bit about what public health has been doing. We've been actively working to support residents throughout the recovery process. This has included providing critical information, resources, and protective supplies to help individuals and families returning to their homes or to the fire-burned areas. Our teams are on the ground. They're engaging directly with you in your communities, and we're ensuring that you have the guidance and the tools that you're going to need to protect yourselves and the people you love during the challenging days ahead. We're also committed to ensuring that families, school staff, and community members have information and resources that help them create safe places for children in our schools and in our community. To ensure, and we can go to the next slide, that you have access to the recommendations and to information about assessments that are ongoing. We have a dedicated wildfire webpage that you can get to at ph.lacounty.gov/wildfires. On this webpage, you can find post-fire air, water, and soil assessment updates, including an interactive tool that allows you to search results of assessments by the location. There's also health and safety guidance to help families, school staff, and local businesses reduce exposures to contaminants. We have a frequently updated, frequently asked questions that provides clear, practical information based on the concerns that we hear from you, from parents, from teachers, and from workers. Additionally, LA County, we'll go to the next slide, has been working with multiple academic institutions, environmental agencies, and local partners to conduct extensive testing in the communities affected by the wildfires. This includes air quality monitoring, soil sampling, and water testing, all designed to assess potential contamination and inform mitigation efforts in communities affected by the fires. We know that you're interested in making sure that you have access to this information. I urge you to get onto the website. Hopefully on April 1st, we'll also be launching a dashboard that will provide extensive information on the assessments that are happening in the communities and the results as they become available. Because the wildfire recovery process is dynamic, we do update the webpage weekly with new data as it becomes available. So feel free to visit this site, and when you're on this site, I also want to let you know that there's an email address that you can get to, and you can email us your questions. So it's not just tonight, but if at any point you want to go ahead and email us your questions, you can see the address listed there. I also want to let you know that we have a town hall tomorrow, and about every 10 days, where we have the scientists that are doing the assessments talk about their results and answer your questions. As I said, it's tomorrow at 6 p.m. You can watch it on our YouTube channel, Facebook, and X. Our goal is to really make sure you have the tools, the knowledge, and the resources that will help you make good decisions for you and your family. The next slide. Tonight, we've designed this to offer you an opportunity to hear briefly from some people who have been engaged in your communities and at your schools, and to try to spend most of the evening answering your questions. Please note that we have live Spanish translation services during our event tonight. Para escuchar en español, por favor llama al 1-800-805-1150. We'll start by sharing updates on the post-fire assessment process, what's been tested so far, what the data is telling us, and how those findings will be used to inform mitigation efforts. Speakers are also going to provide some practical advice on the steps schools are taking to ensure that we're able to address issues related to the fires, including enhanced cleaning protocols, monitoring, and ongoing communication efforts. Finally, we'll discuss the support services that are available to families, students, and school staff as you work through this recovery process. As I said, after these short presentations, we're going to dedicate the remainder of the meeting to answering your questions. I want to thank everybody who submitted questions already. I also want to let people know you can submit questions at any time by typing it directly into the YouTube chat or by commenting on our live stream on Facebook or X. The team's actively monitoring these platforms, and they'll bring the questions forward during the question and answer period. I want to start by introducing Manuel Carmona, who's the director of the Pasadena Health Department. Mr. Carmona will highlight Pasadena Public Health's role in fire response efforts, including specific guidance for schools and strategies to protect students, staff, and families. Welcome, Mr. Carmona.
Thank you, Dr. Ferrer, and good evening, everyone. My name is Manuel Carmona. I'm the Director of Public Health for the City of Pasadena. I send everyone impacted by this terrible tragedy my heartfelt condolences as we navigate the recovery process together. While I work for the City of Pasadena, I am an Altadena resident, and my children attend Pasadena schools. Know that no matter where you live, I stand with you all during the recovery process. I appreciate the opportunity to share information about the Pasadena Public Health Department and our work supporting schools during the wildfire recovery. Next slide. Before I share what we are doing to support the wildfire recovery, I want to briefly share who we are. Established in 1892, the Pasadena Public Health Department has served the community for over 130 years. We are one of 3 city-based local health jurisdictions in the state of California. Our focus is on responding to the public health needs of the city of Pasadena, and we collaborate and work closely with our public health colleagues in the city of Long Beach and county of Los Angeles. Next slide. We use data to drive decision-making in our approach. Our wildfire response efforts include coordinating testing at 9 city facilities, including surface-level lead testing, air testing for asbestos, and we're pleased to report that all test results were within threshold levels. We also review AQMD testing and mobile air monitoring results, which the majority to date have been within background levels, with some elevated levels of heavy metals in some Altadena neighborhoods. We are also preparing to deploy a sensor at the Pasadena Public Health Department located in the northern part of the city, so we can participate in the Caltech Phoenix Air Quality Monitoring Network. And finally, we are deploying purple air sensors at city facilities across areas of northern Pasadena to gather real-time neighborhood level air quality data. Unfortunately, A single data point assessing safety of environmental conditions simply does not exist. So we have to piece together results from a patchwork of different studies and data collection efforts. To aid in this effort, Pasadena Public Health Department staff participate on several task forces, including the Los Angeles County Department of Public Health Task Force on Health and Social Services. Together, we are tracking over 24 data collection efforts launched after the Eaton and Palisades fires. While more data is needed, air quality has emerged as our best measure for assessing the presence of airborne contaminants. In general, measures of particulate matter 2.5 or PM 2.5 and PM 10 can be useful to assessing if additional precautions are needed. During this time, we all have to shift from a mind frame of safe or unsafe to a mindset with a spectrum that includes more safe to less safe. And everyone needs to practice steps that help identify when precautions are needed. Next slide. The Pasadena Public Health Department offers guidance, test results, and recommendations on the City of Pasadena website, which includes information for educational settings. Next slide. What we know is that debris on fire damaged properties should be treated as toxic. Appropriate precautions should be taken by anyone entering those properties. Conditions such as strong winds or contractors who conduct property cleanup without required dust mitigation measures can increase the risk of exposure to those in the community. Everyone should avoid areas where any ash or soot has collected, and we need to monitor conditions that may mobilize dust into the air and take appropriate precautions when air quality is unhealthy. Next slide. As it relates to educational settings, school within or near the Eaton fire burn areas should take precautions to reduce the potential risk of exposure, including regularly inspecting and cleaning outdoor areas, maintaining air filtration systems with high efficiency filters, and keeping windows and doors closed as needed. They should also monitor weather, wind, and air quality conditions and adjust outdoor activities accordingly. And if needed, schools should work closely with remediation experts. The City of Pasadena continues to partner with county, state, and federal agencies to assess wildfire impacts on the environment, share public health guidance, and ensure coordination and access to recovery services. And with that, I will turn it back over to Dr. Ferrer.
Thank you so much, and really appreciate the good advice. And I think everyone appreciated hearing from you. I want to particularly give you a shout out, Manny, for the amazing partnership. And Pasadena is very lucky to have you leading their public health department. But I am also honored tonight to introduce our next speaker, who is Suman Bravo Kurimi, the Chief Business Officer at the Pasadena Unified School District. Mr. Bravo Kurimi will discuss Pasadena Unified's commitment to school safety through enhanced cleaning measures, consistent communication with families, and making sure that there are resources available to support students and staff during the recovery. Thanks a million. I know you're super busy, so I feel very lucky that you were able to join us tonight. And I'm turning it over to you.
Thank you, Dr. Ferrer. Good evening, everybody. Again, I'm Suman Bravo Karimi, Chief Business Officer at Pasadena Unified School District, to share some information about our efforts to date and how we're going to continue to monitor health and safety conditions moving forward. Next slide, please. So, as folks are aware, Pasadena Unified School District was severely impacted by the Eaton fires. And our initial efforts were, of course, focused on the safe reopening of our schools. So here you'll see kind of the goals and objectives that we've had since the fires. First, you'll see, of course, reopen safe and healthy environments, restore the community reconnections that are so necessary for our students and families, and then, of course, ultimately to rebuild and rise to ensure the continuity of learning. Next slide, please. So while we were very focused on reopening our schools as quickly as possible, we were also focused on doing so to make sure that we were providing with our students and our staff and our families with a safe environment. So while, of course, we were very eager to have students back in front of their teachers so that they could start their learning, make sure that we were doing so in conditions that were healthy and safe. So cleaning crews and EnviroCheck, which is our environmental consultant, worked to ensure that all schools were cleaned and cleared environmentally before reopening. We do have a web page dedicated for updates related to the fires. You'll see it there on the page. It's pusd.us/fire-relief/safety. And at this site, you'll find a lot of very helpful resources, which include safety fact sheets with details on the level of cleaning that was done, the environmental testing that was done, as well as the results themselves of those environmental tests. So along with the environmental test results themselves, you'll see some frequently asked questions about how to interpret and understand those test results. There's a lot of data on those test results, and so we want to ensure that our stakeholders could understand what they were reading. So a lot of information there on that website, and I'm just going to give a high-level overview of the cleaning efforts that were undertaken. So all Pasadena Unified School District sites were cleaned, sanitized, and passed environmental tests before they were reopened. This included, again, all Pasadena Unified School District schools, offices, or services, as well as our campuses that were occupied or were to be occupied by our partner charter schools. In addition to our own maintenance and operations staff, we had specialized contractors who undertook the cleaning and in total involved more than 1,500 workers. We cleared over 160 tons of debris from our sites. And of course, when we reopened, we ensured that masks were available for students and staff. So again, at this website, you'll find a lot more information about the interior and exterior cleaning efforts that were undertaken by the personnel that I mentioned. Next slide, please. So Mr. Carmona mentioned some of the guidance that were received by schools. So on March 17th, Los Angeles Public Health Department issued information about school and educational settings in both the Palisades and Eaton fire zones. And the good news is that this new guidance affirms the practices that we at PUSD put into place before we even reopened our schools. So first, Pasadena Unified custodial staff was trained and conducts regular inspections and cleaning of outdoor areas, playgrounds, our equipment, to ensure the prompt removal of any ash or debris that may accumulate. So again, this is an ongoing monitoring and cleanup work that our valued maintenance and operations staff were trained to do. Since COVID, Pasadena Unified has maintained hospital-grade air filters in every classroom and learning space, and those filters are changed twice a year. So those hospital-grade air filters are an even higher level than what is recommended by the recent guidance that was released on March 17th. We also, of course, monitor weather, wind, and air quality conditions, and we issue notifications daily to our schools with directions on any adjustments that may be needed based on those conditions to outdoor activities. Again, as I mentioned, we contracted with professional remediation experts, industrial hygienists to clean and sanitize, and then ultimately test our schools before reopening all of our campuses and offices. And those test results, again, are posted at the website at the link that you see there. And we are, of course, as always, consulting with our colleagues in local and state agencies, including Pasadena Public Health and LA County Public Health, to continue to ensure for the safety of our campuses. And so if any additional testing is recommended or necessary in those consultations with our colleagues in public health, then of course we will do so. Next slide, please. So as a result of all of that extensive cleaning and testing that we did, we opened all of our schools within 17 instructional days. And you'll see on this slide,
Somehow we lost you for a minute there.
Oh, I'm sorry.
Okay.
Can you hear me?
Yes, now we can.
Okay. I apologize. So we reopened our schools after that extensive cleaning and testing in 3 phases. The schools that were furthest from the fire that we were able to access first were those that were able to be cleaned and tested the quickest. And then, of course, phase 2 and 3 were as we started to approach closer to the fire area. And those schools were ultimately all reopened by January 30th. So again, while we were very eager to have students return to their learning environments and be back with their teachers and administrators and their classmates, we made sure that we did so only when those schools were environmentally cleared and safe. Next slide, please. Next slide, please. And so finally, unfortunately, because of the direct impact of the fire, because we did have a substantial or total loss of 5 of our campuses, we did relocate several schools. I'm not going to go through all of the school relocations, but we did relocate both Pasadena Unified Schools as well as charter schools, but of course only relocated to schools that were professionally cleaned and environmentally tested to ensure their safety.
Thank you so much, Mr. Bravo Karimi. I mean, not just for tonight's presentation, but these are a lot of schools and there was a lot of work in reopening. And I know it was really good to hear the focus on really designing the reopenings to accommodate extensive cleaning and testing. I found that reassuring, and I know that when we get to questions, lots of folks here are anxious to be able to talk with you to better understand all the work that you all did. So thank you so much. And we'll go on to our next speaker tonight is going to be Dr. Quick, who's the Chief Medical Advisor for the Los Angeles County Department of Public Health. Dr. Quick brings extensive experience in environmental health and emergency preparedness. She's going to provide some important information on a post-fire assessment plan, including what's being tested. She'll note a few of the early results, and she'll spend some time just outlining some practical steps that we can all take to protect ourselves in and around impacted communities and schools. So Dr. Quick.
Good evening, everyone, and thank you for joining us tonight and for taking the time to learn more about the health and safety of our schools following the recent wildfire. Tonight, I'd like to provide an update on our post-fire assessment efforts, what we've learned so far, and most importantly, how you can protect yourselves and your families. As recovery efforts continue and residents return to their regular activities, LA County Public Health wants to remind everyone of the potential dangers associated with fire debris in and near the burn areas. Individuals in these areas may face an increased risk of exposure to hazardous substances such as ash, soot, and fire debris, particularly before cleanup phases are complete. As you probably know, there are 2 key phases in the cleanup process. Phase 1, it focuses on hazardous material removal, and phase 2 focuses on fire debris removal. Until both phases are complete, exposure to these materials can lead to physical health symptoms and may pose long-term health risks. Conditions like strong winds or changing weather can increase the risk by spreading ash and debris over a larger area. As a general rule, the closer you are to these areas where fire debris has not yet been removed, the higher the potential risk for exposure. This is why we encourage residents in impacted areas to stay informed and follow ongoing public health guidance as those cleanup efforts continue. All right, do we have the slides? I'm not sure. First slide would be great. Perfect. As Dr. Frere mentioned, following the fire, LA County Public Health worked with academic institutions, environmental scientists, and state and local partners to launch a comprehensive post-fire assessment plan. The goal of this plan is to assess potential risks in our neighborhoods. Our testing efforts are focused on identifying key contaminants that are known to be present after a wildfire, including particulate matter, which can primarily impact air quality, heavy metals, which may settle in soil or ash, and volatile organic compounds, or VOCs, which are chemicals that can pose health risks when inhaled. By gathering this information, we will be able to provide science-based recommendations that support school leaders in making informed decisions about cleaning procedures, ventilation, and other safety measures. Next slide, please. I want to briefly cover how parents, staff, and students can protect themselves. There are steps that families and staff can take to stay safe during this recovery period. First, if your child's school is located near the burn zone, we recommend the following precautions. Minimizing outdoor activities if and when air quality reports indicate elevated pollution levels. Encouraging schools to use HEPA air purifiers. We've already heard about a lot of the measures that schools have put into place. And if your child has a respiratory condition such as asthma, be sure to follow your doctor's guidance and ensure they have their medication available at school. Next slide, please. At home, we strongly recommend that families use damp cloth or wet mop when cleaning surfaces to avoid stirring up ash and dust. Washing hands frequently, especially before eating or drinking, to limit exposure to potential contaminants. And when gardening or working in outdoor spaces, wear protective gear such as gloves and N95 masks to reduce exposure to disturbed soil or ash. For schools, we've provided detailed cleaning protocols that focus on safely removing debris and properly ventilating indoor spaces to ensure healthy learning environments. Lastly, I want to emphasize that LA County Public Health is here to support you through this recovery process. Our dedicated wildfire safety webpage includes updated testing results for air, soil, and water. We also have clear guidance on cleaning procedures, ventilation strategies, and other ways to minimize exposure. A contact form is also available for anyone with questions or concerns about school safety or recovery efforts in general. I encourage you to visit this page frequently. We update the information weekly so that you have the latest guidance. In closing, I want to assure you that public health is committed to working closely with school leaders, parents, and the community to ensure schools are safe and students are protected. Thank you again for your time tonight, for your dedication to your children's well-being, and for your ongoing partnership as we continue these important efforts.
Thank you so much, Dr. Quick. And now it's my pleasure to introduce Dr. Gilchick, the Medical Director for the Division of Maternal, Child, and Adolescent Health at the LA County Department of Public Health. Dr. Gilchick will provide school-specific guidance related to post-fire cleaning and best practices to ensure a safe and healthy learning environment for students and staff. Dr. Gilchick.
Yes, thank you, Dr. Frere. I appreciate everyone for making the time to join us this evening and for your dedication to protecting the health and well-being of our students and school staff. I know that for many families and school communities, concerns about safety following the recent wildfire are top of mind. So tonight, I'm going to share important information about how schools can reduce potential exposure to fire-related contaminants through proper cleaning procedures and best practices to optimize the safety of the learning environment. As a reminder, it's important to understand that wildfire impacts can continue to pose risks, including on and around school campuses. In areas closer to the fire zone, schools may be at higher risk for lingering ash, soot, and debris being carried by wind, especially during periods of strong gusts. Additionally, poor indoor air quality caused by wildfire smoke can impact students and staff, particularly those with conditions like asthma or other respiratory issues. Fortunately, there are clear steps schools can take to reduce these risks and maintain safer spaces for learning. So if you guys would project the next slide, please. Now I'm going to review the key cleaning guidance for schools, and I'll divide this into a few different categories. Schools that are reopening or continuing to operate in fire-affected areas should take these important cleaning steps, starting with outdoor spaces, including playgrounds. Regularly inspect and clean outdoor areas, such as playgrounds, sports fields, and equipment, to remove accumulated ash and debris. Rinse down outdoor surfaces with water rather than dry sweeping or using leaf blowers, which can stir up the contaminants and spread them more widely. And clean outdoor lunch tables and other outdoor surfaces regularly, especially after windy conditions. Next slide, please. Next, I'm going to talk about the classrooms and other indoor spaces. Thoroughly clean all surfaces, including desks, tables, and floors, with a damp cloth or wet mop to reduce dust and ash. Use a mild soap or detergent for cleaning, and rinse surfaces with plain water to remove any remaining residue. Vacuum carpets and upholstery using machines equipped with HEPA filters, which capture fine particles. Now, for classroom walls and ceilings affected by soot, an effective measure is to use a solution of trisodium phosphate mixed with warm water. It is important that staff who are doing cleaning have proper ventilation while they're cleaning, and to rinse right away with plain water to get rid of the residues of the cleaning solution. Next slide, please. Good. And third, addressing indoor air quality. Schools should set their HVAC systems to recirculation mode to limit outdoor air from entering indoor spaces when the outdoor air quality is poor. Regularly inspect and replace system air filters with those designated MERV 13 or higher, which are effective at capturing fine particulate matter from wildfire smoke. Consider adding portable HEPA air cleaners in classrooms for additional filtration, especially if the HVAC system does not support the higher grade filters. And schools should also clean the HVAC air intakes to prevent smoke and ash buildup in the ventilation systems. Next, please. Finally, water systems. In areas heavily impacted by fire, schools should flush their water systems before reopening to ensure the pipes are clear of potential contaminants. Drinking fountains or hydration stations should be cleaned and flushed thoroughly before resuming use. And last slide, please, for me. Great. In addition to these cleaning protocols, schools should adopt proactive strategies to reduce exposure during periods of poor air quality. So schools should routinely check the Air Quality Index, or AQI, via trusted resources like airnow.gov or the South Coast Air Quality Management District app, AQMD. On days with elevated pollution levels in the area of the campus, schools should limit outdoor activities and ensure windows and doors remain closed. It's very important to support the more vulnerable students. Schools should take special precautions to protect students with asthma and other respiratory conditions, heart conditions, or other relevant health concerns. Ensure that those students have quick, easy access to their prescribed medications like asthma inhalers, and that staff are aware of emergency response procedures. Schools should actively communicate with parents about air quality concerns, cleaning efforts, and guidance for students with respiratory or other medical conditions. And post clear signage and share information regularly and freely about protective measures that can help ensure families feel informed and prepared. For schools in or near heavily impacted fire zones, we recommend working with remediation experts for specialized cleaning, particularly when dealing with fire damaged structures or persistent odors. And these experts can also make customized recommendations regarding the most appropriate environmental testing for each school's particular situation, such as assessment of soil conditions on school grounds, especially in areas where debris may have accumulated. So wrapping up my comments, I'd like to emphasize that LA County Public Health is here to support our schools, families, and workers throughout this recovery process, of course, along with our partners in the City of Pasadena Public Health. By following these cleaning protocols and best practices, schools can significantly reduce exposure to harmful contaminants and create safer, healthier environments for students and staff. If you have questions or concerns about your child's school or need additional guidance, you're also free to visit our website at publichealth.lacounty.gov for a variety of resources and updates. all the guidance that I've provided tonight is available on our website in a number of documents. So thank you for your time and your commitment to protecting the health and safety of our students and school communities. And I turn it back over to you, Dr. Ferrer.
Yeah, thank you so much, Dr. Gilchick. I'm going to go right into questions. And, I'm very pleased we've been joined tonight by Dr. Rangan, who is the Assistant Deputy Director of the Center for Healthy Communities at the California Department of Public Health. Dr. Rangan is a leading expert in medical toxicology with decades of experience investigating environmental health risks. And we're very lucky to have him here to help answer your questions and provide insights. So I'm going to start with you, Cyrus, if you don't mind. And I think it's good because some of us have been, sort of right here in the community, living this work every day. And I certainly want to give so many thanks to Mr. Bravo Carini and to Mr. Carmona, because they've answered question after question after question at a whole host of community meetings. But I always think it's good to get different perspectives, and oftentimes from folks who may not be as intimately involved in the day-to-day. We have, I would say, almost a dozen questions on this one topic. So it would be wonderful, Dr. Rangan, if you could weigh in on this. What would be your recommendation around how schools should handle a situation where they've reopened for in-person learning, but they're adjacent to burned structures that have not yet completed phase 2 cleanup? Just so everyone knows, phase 2 cleanup is the removal of fire debris. And, that happens parcel by parcel. And there are definitely places where cleanup has started but has not yet been completed. I have literally a dozen questions around how can this be done with safety for the students and the staff that are going to be in those buildings surrounded by areas that have not completed phase 2 cleanups.
Great. That's a really excellent question, Dr. Ferrer. Thank you. And this is a question that's come to us quite often here at the State Health Department as well. And so here's my general perspective on that. Without question, it's perfectly normal to be concerned that if my children are next to an area that's being cleaned and that cleanup activity is proceeding, is it possible that something could get stirred up in that area and potentially cause a problem next door, meaning up on the school grounds? And that is always possible. However, when we look at the way that the cleanup approach is being handled, the cleanup is being handled by agencies such as the Environmental Protection Agency, the Army Corps of Engineers, and they take rather rigorous precautions to try to keep those kinds of things under control while that cleaning is taking place. So, for example, they use all kinds of methods to suppress dust as they are handling those materials and then taking them away into landfills and other disposal facilities. And by taking those kinds of precautions, they limit the kinds of exposure that may otherwise occur in adjacent areas to the areas that they're cleaning. So I think that people can find those agencies and experts who are taking care of that cleaning are trustworthy in terms of the rigor that they are employing to make sure that they keep all of those things under control. However, it's also good to verify. And that's what the LA County Department of Public Health and their experts are doing to make sure that we're verifying that the air, the soil, and the water are meeting our safe standards essentially for contaminants, so that when these measures are employed to kind of keep all that contamination under control, we're verifying with all of these tests to make sure that things are staying under control. And we know that this can be a very fluid and changing kind of situation. And because it involves children, we have not only those unknowns, but we also have a vulnerable population in children. And so because of that, the precautions that we're taking during the work, the monitoring that we're taking for air, water, and soil, all culminate in very appropriate and highly protective recommendations that your local public health department officials are giving you. So by that token, I think that as long as you are heeding those recommendations and precautions that come from your local health department officials, then I think we can have confidence that our children are going to be best protected. As Mr. Carmona stated a little bit earlier, we don't just talk about safe versus unsafe. We talk about how we can best protect you under the circumstances. And that's the approach that we need to take when we think about how we can best protect our children while they're at school.
Well, that was so helpful. Thank you so much, Dr. Rangan. I'm gonna sort of do a follow-up question with you, Mr. Bravo Karimi, just because there's some particulars here, and I think you're probably very well suited to answer. I think there is a lot of confusion about what kind of testing has been done at the schools when they reopen, but there are also questions about schools that are opened in areas where they're adjacent to burn structures, and whether or not you're going to be continuing, for example, what kind of soil testing will you be doing in outdoor areas as the recovery process continues. I do want to say we've got a couple of campuses that are noted here, and I want to thank all the families that called in. So there's very specific questions about Calaveras campus and also questions about the Altadena Arts Magnet that I think hasn't opened yet. But there are concerns about what kind of testing, particularly around soil testing ongoing as fire debris gets moved through the communities towards, for those disposal sites. That was a lot of question there, but we have so many questions. I'm trying to see if I can combine some of them for you.
Okay, thank you. So my connection cut out for the last part. So let me just answer the first question, and whatever I didn't address, if you could just maybe repeat the question. So as I mentioned in my presentation, we follow with respect to what was tested at our campuses, at all of our campuses, including those that you mentioned that are very near fire debris, burn structures. And so we follow the recommendations of our industrial hygienist. And we also, of course, as I mentioned, collaborated and consulted with local, state, and federal agencies to determine what was necessary before feeling comfortable and knowing that our campuses would be safe to reopen. And so based on those recommendations, we conducted the tests inside the buildings. And then based on those recommendations, we also did the extensive cleaning of both the interior and exterior of our campuses. That included, again, the website has all the details, but it included a lot of what Dr. Gilchick mentioned about recommendations in terms of HEPA vacuuming, wiping every surface, of course, removal of all ash and debris and soot, power washing of play structures to ensure that we were implementing all the recommendations of our experts. Of course, we will continue to consult with our experts, with our Pasadena Public Health colleagues, as well as County Public Health, and then any relevant state agencies on any additional recommendations or requirements that may be coming forward.
Suman, I think the other part of the question, and I'm sorry that you missed, was I think for some parents, they've appreciated all the testing, but now that their students are back, they're wondering what the ongoing testing is. So if the fire debris is in the process of being moved, and I think Dr. Rangan gave us a really good picture of how that happens. But I think some of the families really would love to hear more about your ongoing testing. Particularly, would you be testing soil as the fire debris is perhaps being blown around a little more than anticipated?
So yeah, we are consulting with local and state agencies to determine if, where, and if and when that type of soil testing would be conducted, and certainly, we will continue to do so. As I mentioned, we obviously trained our staff to continue to monitor and clean any accumulation of matter on exterior spaces, and we of course monitor air quality as our colleagues in the public health community. and changing any outdoor activities as needed based on that data.
Thank you so much. I'm going to ask one more question. And I'm going to start with you because it's related directly to schools, but I want to make sure the other panelists who I know have information about this chime in. There are some questions that are being asked about why there's not more testing that's being done for heavy metals and toxins. So I'm going to start with you, obviously, because you're there and you know what you've tested for already. But I know this will hopefully allow some of our other panelists to also talk about testing that's being done in the community.
Sure. So I mean, again, we tested. I think people won't be surprised to hear I'm not a public health expert, and while we've learned a lot since the fire, and of course, as I mentioned, our top priority was not just to get kids back in school, but to do so only when it was safe. And so, to the extent that through our continued consultations with your department and the city of Pasadena, and our environmental consultants and our experts, our industrial hygienists, we tested what was recommended, and of course, when in that consultation, we informed our public health colleagues of the extent of the testing that was done to ensure that it met all recommendations and requirements. And so we do thank County Public Health for those continued interaction and for kind of giving us a stamp of approval when we described the things that we were testing and where we were testing, and so we really appreciated that before reopening.
Yeah, thanks so much. Mr. Carmona, I'm just going to go to you as well, because you talked a little bit about the air testing, the air quality testing, and there are some parents that have called in, that have written in with questions about, is there a regular schedule for testing? In particular, they want to know if you've got a budget for testing, particularly around air quality, and if you're going to be able to test in those areas that are on the routes where there's fire debris being transported, and next to schools that are closest to the fire lines.
Yeah, and thank you for the question. And maybe I can also add a little bit more information to the last question that was posed to
Absolutely.
Mr. Bravos-Karimi. I think, when we look at, the types of environmental conditions, we start with where we believe the biggest threats may lie. So there's a lot of testing in water just to make sure that drinking water in Pasadena was safe. Of course, in Altadena, there's a couple water companies that have not been able to reopen and provide water because they have infrastructure damage, but that testing is around the corner and we look forward to seeing those results. When it comes to air quality, really we're relying on AQMD and EPA's Air Now, and there's a lot of really good information about how that applies to the community, but unfortunately the stationary monitoring is really for the entire community and provides 24-hour averages rather than specific real-time neighborhood level data. So I'll talk a little bit more about that when I answer your second question. And then of course the third is really looking at any potential contamination in soils. And so as we have worked with the task forces and the different folks that are doing studies, as I mentioned earlier, and very well, Dr. Ferrer, we have academic partners, experts in the field, public health colleagues at every level of government who are now looking at assessing environmental conditions and looking at soil. It really has been an evolution of resources becoming available to communities, including Pasadena. Some of the testing has been regional, but we are continuing to advocate for resources to be deployed in Pasadena, and specifically at sites such as schools and at city parks, because we know that that's where children will be and are most likely to be. And we want to affirm that it's safe for them to use them. At this point in time, we have no evidence that these sites or any others are not safe for families to use. And so we really do want to get more data so we can share that with the community and give everybody peace of mind. And conversely, if there is anything that needs to be remediated, then of course we want to know that as well so we can take immediate action. So turning to the second question about air quality, as I mentioned, AQMD and EPA Air Now provide 24-hour averages, and that's really the way that the thresholds are built is around 24 averages, so the 24-hour average exposure. Whereas some of the things that we've been trying in Pasadena, like purple air quality sensors, as well as the Quant C higher sensitivity air quality sensor that's being deployed at the Pasadena Public Health Department through the Caltech Air Quality Monitoring Network, are going to provide us additional data. That data is not based upon the 24-hour average, so it can be compared. It's not comparable for apples to apples, but it gives us a sense of what's possibly in the air in that moment that may need that could inform our decision making for that particular day's activities. And so Purple Air is a great network that's available publicly, and we can see what PM 2.5 is looks like. And there's several Purple Air sensors that are deployed along Woodbury Road as well as New York Drive, where the debris hauling trucks are actually taking their routes. In addition, the Caltech sensors, there's 25 that are being deployed. I heard today that there's going to be a little bit more a higher number of sensors than 25. The 25 are going to be deployed, and that's going to add another layer for us to understand what's going on in the air quality around us. And if there needs to be additional testing of air by AQMD or others, then hopefully this information will help us advocate for those resources to be deployed.
Oh, thanks so much. That was a comprehensive answer. And I'm going to actually ask if Dr. Quick can also talk a little bit about the testing that we have a consultant doing in the Altadena, Pasadena area. When those results will be available, and just to remind folks that, there are lots of both academic partners and government agencies that are trying to contribute to the picture of what's going on in the air, in the soil, and in the water. But I thought, Nicole, it would be great if you can just give some updates on that.
Yeah, I would urge everybody to go to that post-fire assessment page for the latest results as they come in from all of the academic partners, but specifically for LA Department of Public Health, we are working with an external consulting firm that does environmental testing to do a representative sample of soil, ash, and soot testing within both burn areas, but relevant to this discussion tonight within the Eaton burn area and adjacent to it to really get an idea of what is in the ash and soot. So like worst case scenario as far as, contaminants, looking at the actual ash and soot, looking at properties within the burn area as well as adjacent. And so that information is really going to help us characterize what we're seeing in there and what is the potential risk associated with that. The analysis is underway right now. We do expect to have more concrete results to share in several weeks with everybody, and we will be coming back publicly to talk to people about what that means. We are also doing a further analysis with that same consulting firm that is just getting started, that's related to what does this look like after cleanup has taken place. So not specific to any given property, but what is the potential risk that remains after cleanup? And so we will, that analysis started, of course, after the first one, so that will take longer for us to complete, but we will be bringing this back in the form of, town hall and get that information out once we have more on that.
Yeah, thanks so much. And just so folks know, we do have one town hall tomorrow night where our consultant will be describing all of the sampling that's being done. And then they are scheduled to return in 2 weeks and present the initial results of what we're going to call stage 1 and stage 2 testing. Stage 3 is the testing that's being done on soil after remediation. But I want to make sure folks know that we're trying to fill in gaps where we see that something hasn't happened. We're trying to either identify an academic partner or a government partner that can fill in some of the gaps. I think we all appreciate, we've never seen a fire of this magnitude. And, we like you, want to make sure that questions are being answered and that the assessments are targeted to provide more information. to the information you're looking for. But it is, as everyone has noted, it is a changing landscape, and I appreciate, I think the questions are really important because the landscape does change, and it's right to really want to know exactly how ongoing monitoring is going to happen in places where there might be increased risk, particularly as debris gets moved out of our neighborhoods and over to the appropriate landfills. I want to go back to Dr. Ragnan, because I think there's some questions that I think parents would appreciate hearing from you on just what are the risks in general associated with lead? I mean, there are some questions around, you know, there are a couple of questions recognizing that historically we have elevated levels of lead in properties, particularly in soil around older properties in LA County. And then folks are wondering what can they do, assuming that those levels might be higher after the fire. So I don't know, Dr. Ragnan, feel free to chime in. Dr. Gilchick, you as well.
Sure. Yeah, I can give my perspective on that. Lead is something that is all around us, and there's so many different kinds of sources of lead that we potentially might be exposed to. The number one source of lead for lead poisoning in children, of course, is lead paint that we find in a lot of old housing. But yes, there is some lead in dirt, and it's a naturally occurring substance that we do have in dirt. And we do know that some, especially young children who may be going out to play in dirt, sometimes that is the reason that they may have an elevated level of lead in their blood. So we do definitely regard soil as a major source of lead contamination that leads to potentially lead toxicity. Now, in terms of the kinds of health effects that you may get from it, it can range anywhere from no health effects, or at least no apparent health effects, all the way to some very severe health effects that include anemia, that may include nerve damage and effects on our behavior and our cognition and our thought processes and things like that. So there's a big range of symptoms and signs that people can get from exposure to lead. But the vast majority of people who are exposed to lead actually don't have symptoms, which is why we do a lot of screening of young children for lead at very young ages. Now, back to the situation with soil and fires and lead content that may be elevated. Yes, it's true that there may be elevated lead content in some of these burned areas, and particularly because of many of these older houses burned and deposited lead into the soil area. The phases of cleanup that have been taking place, the phase 1 cleanup and the phase 2 cleanup, are designed to essentially remove that whole top layer of deposition of lead that may have occurred during the fires. So that's good. So from that standpoint, the extra lead that may have been deposited upon soils is going to be removed by these cleanup procedures. And as I mentioned before, during the process of cleanup, precautions and measures are being taken by the experts who are doing the cleanup to keep suppression of dust under control, to make sure that that's not going to be reaching or emanating out into neighboring areas. One thing I wanted to just to add to that in terms of the protection that we are employing there, the workers, the expert agency workers who are doing this cleanup are all wearing air quality, air monitoring equipment on their person. And that's a very good thing because it does go very far for worker protection, and that's what it's designed for. But it also helps us from a community perspective because those monitors also act as a proxy. So in other words, if the microenvironment of the air around the workers is not getting elevated with lead and other contaminants, well, that tells us that it's also probably not getting into the community as well. So it's just yet another way that we can have some reassurance that the contamination is staying where it is, will be removed from where it is, and then taken to disposal sites, and probably won't be reaching neighboring areas.
Dr. Gilchick, did you want to add anything? Thank you so much.
Yes, I did actually. Just one extra tip or opportunity to add to Dr. Rangan's excellent information. Through a partnership that we have, LA County Public Health have with Quest Laboratory Corporation, we're making opportunities for blood lead testing for folks in the impacted areas who are concerned about possible exposure. And although the environmental remediation is critical, if you really want to know if someone has had a dangerous exposure to lead, the best way is to test the individual. So we're making that available. The first 3 ways you can do that. The first is you can just go to your regular family doctor or pediatrician, explain that you're concerned about exposure, and you should be able to get the test. However, if there's any issues with accessing your medical doctor or insurance issues or anything like that, there's 2 other possibilities. You can go directly to a participating Quest laboratory sample center where they can take your blood. I can give you our lead hotline where you can get an appointment and find out locations. That number is 1-800 LA4 lead, so LA number 4 and LEAD. It's also the number 524-5323. And then the last option.
And just that's free. So I just want to make sure.
Oh, yeah,
anyone
exactly.
can go, adults and children, and
Yeah.
it's completely free.
Yes, thank you. Thanks for that clarification. The third option is we are actually participating in some community events, 2 or 3 events over the next few weeks in the Altadena, Pasadena area. And you can also get the dates and locations from the same number from the hotline. They're weekend dates. I believe they're Saturday or Sundays. So please take advantage of that if there is concern.
Yeah, thank you so much for that. And I'm just going to amplify on that. Just some good news. I mean, we've been offering the testing for a little while now. I think we've had over 100 people that have voluntarily chosen to be tested. So this isn't a representative sample. These are people who were concerned and wanted to be tested. And all of the results to date have indicated there are no elevated levels of lead that have been noticed. That doesn't mean that you shouldn't check if you've got concerns. I think the other thing I want to say, and this is just probably the grandparent in me, because there is lead in soil and in many places, it's good practice for everyone to remind children, particularly smaller children, of the importance of not putting their hands in their mouth and of everyone doing a lot of hand washing, before they eat. I mean, these are really ways to reduce exposures to a whole host of things, but they also work around lead. Not having anybody tracking soil into your home. I know people in LA are very used to this, to take off your shoes before you come in rule is a good rule to follow, particularly for those people in areas adjacent to the burn. Don't track in things from outside. Keep outside shoes worn outside and keep the inside free of bringing in potential contaminants. And the last thing I just want to note is that we do have some extensive information on our website. I know there weren't questions about this that I see so far, but I know there are questions around gardens at school, gardens at your home. We have extensive information about how to continue gardening with a lot of safety after a fire. So I'm going to urge people to go ahead and take a look at that. I wanted to come back. We have some questions. We haven't gotten to water yet, but I want to come back. We do have some very specific questions about water, and perhaps I can start with you, Mr. Bravo Carini. We have some specific questions about, were all the water fountains tested at schools as was recommended? Was all of the water, there was a recommendation after water got turned back on in places where it was turned off, that water had to run for a while. So people are just asking questions about making sure that all the water in the schools, in the fountains, in particular is safe, and that you've done some testing on that.
Sorry, can folks hear me?
Yeah, we can hear you.
So for water, of course, we relied on information we received from the relevant utilities, Pasadena and Altadena that service Pasadena, Altadena, and Sierra Madre about the safety of water, and then followed guidelines about flushing systems before reopening schools to ensure that the water was safe for our students.
That sounds good. And I don't know, Mr. Carmona, if you want to add anything around water safety. I think it's a really good point to know that you cannot run a water system in California without there being rigorous testing that happens fairly often at the water system level, so that the water that is coming in through the pipes is actually safe for people to drink and use. But I don't know if you wanted to comment on that as well.
I would just note that Pasadena Water and Power is a locally operated municipal utility, and the tests that were conducted came back and demonstrated the water quality was excellent and that it did not have any kind of toxins in it. And we were very confident in making that water available not only to our schools, but to the entire community. So everybody should have confidence in the water that comes from the Pasadena Water and Power Department.
Yeah, I'm going to stay with you just for a second, Mr. Carmona. I have this, great observation, and really, I think this is a plea for our help. So I'm hoping we can help. But thousands of trucks carrying hazardous fire debris are driving directly in front of Jackson daily. Can the debris trucks be rerouted so they don't pass in front of the school? What kinds of steps should we be taking to make this happen?
Yeah, I think so definitely understand the concern. And of course, there's hundreds, if not, several hundreds of trucks that are going through Woodbury in particular. But I think a couple of things should be noted is that the way that the debris is wrapped and carried in the trucks is a very special and very effective way to make sure the debris is not coming off of those trucks. So all the trucks, the dump trucks, have a very thick plastic lining that goes into the trucks before any debris is loaded. And then all the debris itself is burrito wrapped. So it's put onto a tarp, wrapped up like a nice little burrito, and then it's loaded onto the truck. And then there's another tarp that goes above the debris, covering everything that's in the load, so that there's no possibility of something being cast into the air wherever that truck may be. Of course, the still presence of the exhaust from the trucks and anything that might be on the roadway from the trucks running there with a high additional traffic could be a concern. But as I mentioned earlier, when we look at the purple wire data along these routes, the sensors are not picking up any additional indicators that PM 2.5 is at a higher level along the truck routes than when compared to other areas of the city. In fact, it's staying very consistent with the rest of the city, and that's really a good sign. Now, more data is needed. We need more sensitive air sensors that can detect PM10, and we need to make sure that if there are any concerns that arise, that we immediately advocate with not only the Army Corps, but that we advocate for regional coordination, because if these trucks are rerouted, they're going to be sent to another area, and that, of course, is going to be impacting that particular neighborhood. So as of right now, the data doesn't show an impact, but we're going to continue to vigilantly monitor it so that we can make sure that we address any issues that arise.
That was really helpful. Thanks so much. I think maybe this question is for Dr. Quick. Who's holding the schools accountable? I mean, I actually, anybody could answer who wants to answer. But I think there is a question, and I want to thank the person. There were a couple of people who asked around this. It's like, it sounds great. We've all shared a lot of good information about things that are supposed to be happening at schools, and but some folks are saying they're not sure these things are happening, and they're not sure how we are monitoring the ongoing safety. I think we've had we've had some acknowledgments that schools took really extraordinary efforts to open and put in place a lot of protection. I think a lot of these questions are the sort of ongoing concerns that parents have, particularly of schools that are pretty close to burn areas, and where debris is still not completely picked up and won't be. I mean, I think we're all going to be honest here. The debris isn't going to be picked up for probably a few more months before there's a completion of phase 2. So I think these are really important questions. Like, what can families do to make sure that the testing is happening at schools, that the wipe downs are happening, that outdoor areas are being frequently cleaned and monitored to reduce chances of exposure. So I'll start with you, Dr. Quick, and then anybody feel free to jump in.
Yeah, I think part of this is a big collaborative effort. Some of the things that go into, what schools are doing is responding to guidance that's been put out by multiple entities, including us, essentially saying that part of this is that visual check to see if there is ash or fire debris that's making its way back onto school grounds. So being aware of that, that's in our guidance. There's monitoring efforts that we really haven't gotten into tonight related to air quality, where South Coast Air Quality Management District is monitoring in stationary sites dedicated just to this, to the fire debris cleanup process to evaluate if there's any ongoing potential impact from the fire debris and the cleanup activity. So that's another element of that. I think the schools are well aware of that data and how to kind of interpret that. There's just your standard air quality data that schools have are very well versed in making the determination if it's, the air quality index is something that it would need to alter school activities or even for at-risk sensitive students. So there's that element of that. We have, as far as DPH, held several meetings where we have spoken with our schools and the larger school community to continue to have those discussions about these best practices. I will say, as a larger group in both the soil, water, and air, as we get data in, we are constantly evaluating whether or not there's a potential impact to communities and sensitive individuals, which include our schools. So I think it's this collaborative effort. And as you can see tonight, we're all here together talking about this. We've got state partners, we've got, Pasadena Public Health, we've got our school partners. And so it's this ongoing evaluation that we're doing continually to see if there is a potential impact from these activities. Public health does continue to caution folks that there are still potential exposures out there because we have uncleaned up fire debris. And so that is one piece of it. Safety measures that various entities are taking as far as the cleanup, you heard that spoken about today, to try to minimize any potential impact. And then the big picture of, the urgency of getting the cleanup completed is another big one that we all want to see happen in a timely manner.
Yeah, thank you. Thank you so much, Dr. Quick. I do, I know we're not interactive here, so I'm trying to sort of sift through the questions that parents are asking. There are a few parents that are really concerned about sending children to schools that are in areas that are adjacent to burns, where there's a lot of fire debris in the neighboring properties, or there's a lot of fire debris being removed very close to where the schools are that are either reopened or there's plans about opening them. I wonder if, and you may not have an answer to this, but I wonder if there's, if you have any opportunity to talk to parents about alternatives to not sending their children back to a school that they don't feel ready to send their child to. Because again, my sense here is that there are a few parents who are pretty frustrated with the push to get back into buildings where they feel they have children who have special healthcare needs, or they're just worried in general about unnecessary exposures. So I wonder if you could address that.
Sure,
I know it's a tough question, but I want to be respectful that
sure.
there are parents who would like another option, I think.
So first, absolutely, we want the schools to be safe. But we also want people's perceptions of the schools to also be that they're safe. And so we're going to do everything we can to continue to post information on our website, to continue to participate in opportunities like this, to convey to our communities that we would never do anything that would put their students, our staff, at risk. But to your point, people have different levels of tolerance for these risks, for this uncertainty. And we understand and respect that. And while we certainly want students to stay with the communities that they cherish and where they've been, we understand when families want to make a decision that makes the most sense for them. And so we do have an open enrollment process at Pasadena Unified School District where families can apply to attend other schools within our district. There's a process that's also on our website, and more information can be found there about the open enrollment process, where families can again apply to attend schools outside of their kind of where their attendance boundary where they live. And so there are opportunities. That's an existing process at Pasadena Unified. So that's one option for families that want to explore alternative schools. We also have an independent study program, the Center for Independent Study, CIS is the acronym, where also families can find an alternative to their existing schools. So again, while our priority is of course to make the school safe and to communicate that to our families, there are those opportunities for alternative schools.
Yeah, and I want to thank you. And I also want to note there are other parents that are commenting that are noting how important it is for their children to be back at school. So I think again, I loved how you noted that we all have our tolerance for risk, and we also know our children really well. And nobody can really second guess that. And we appreciate all of you as parents. It's a really hard job that you're doing during these extraordinarily challenging times, trying to balance what really would work for you and your family and your child. And I don't think anybody, we don't think there's a right way to do this and make those decisions. We try to give you a lot of information at these town halls. I know that the Pasadena Public Health Department and Pasadena Unified are trying to do the same. And at the end of the day, we'd like to support you in your decision-making process and for you to feel supported. So I want to thank the parents who are commenting on both sides of this. And I love the commitment that, we're all trying to say, which is, this is unprecedented. And that's what's making it especially challenging. But we are going to all continue to work together to try to do our very best job to be able to make sure that the recovery process is working for as many people as possible. Recognizing what an important community you all were living in, and for some of you, you're still able to live in those communities. So thank you for that. We have time for probably a couple more questions. So I'm going to go, I think I'm going to go back to Dr. Gilchick just for a second. Dr. Gilchick, we have a similar question to what we heard last night, which is, how do we help children and staff who have really experienced a lot of trauma around the fires and are struggling to get back into schools? I'll start with you, Dr. Gilchick, and then, obviously, I know that both Mr. Carmona and Mr. Bravo Karimi have resources that they can talk about as well. But I'll start with you, Dr. Gilchick.
Yes, thanks. I'm happy to address this. This is so important and something that sometimes can get overlooked. We do have a lot of resources on our website as well on this topic in the fire recovery area under resources for schools, but I'll try to give a kind of a high level or quick overview and some guidelines. So first, let's just acknowledge that it's perfectly normal for our kids or adults for that matter to experience, various levels of grief, distress, or trauma in response to this disaster. Particularly for younger children, they may or may not voice this, or older children. Sometimes you may notice just some even subtle changes in their behavior, sleep disturbances, more irritability. The younger ones in particular seem more clingy. On the other hand, some will be more withdrawn. So you're really looking at a change from sort of their normal behavior. But if you are concerned about how they're coping with this, here's a few tips. The first thing is take care of yourself, right? Make sure you're feeling well. Not only is this going to help you, but it allows you to model, healthy, calm behavior for the other members of your family. Absolutely, don't avoid talking about this with your children. Encourage them to talk. Ask them questions about how they're doing, and make sure you're responding to their questions with accurate information. They may have their own misinformation about what's going on. Of course, the language you use has to be developmentally appropriate. You're not going to talk to a 4-year-old the same way you're going to talk to a 10-year-old or a 15-year-old. And then, keep the conversations going. Don't do it just once. What can be really helpful for kids of all ages is to help set some daily routines, especially if they've been displaced for long periods. Their routines have all been upset, and everyone does better with set routines. So try to set up some set routines as close as possible to what they're used to, but there may have to be some adaptations. For folks who were evacuated or may have even lost their residence, make sure they're still getting to see their friends, who they may not live next door to anymore, right? Also, don't be afraid to, turn to your school, their children's teachers. They're your allies. They have special training in this area. Students should be encouraged to talk about the event in school, during class with peers. And actually, the issue with these wildfires could even be incorporated usefully into curriculum and lessons. Think of writing about your experience. What about earth science, biology, math? There's a lot of learning that could actually go on and kind of help to demystify this whole process. Creative endeavors during and after school are helpful too, like art, music, dance, drama, helps kids process their feelings. And the last thing is, most children are very resilient and they're going to recover over time as long as there's caring adults in their lives who will watch out for their needs. But that being said, don't hesitate to consult, your family doctor, pediatrician, or other health professional if you think additional intervention may be needed. I'll leave you with 2 numbers that you could turn to for additional help. The LA County Department of Mental Health has a 24/7 helpline for support and referral for emotional and mental health needs. That number, 1-800-854-7771. And the Federal Agency for Substance Abuse and Mental Health Services actually runs a disaster distress helpline. So they actually could provide disaster counseling and recommendations for follow-up. That toll-free number is 800-985-5990. So help is out there. And with that, I'll just see if anyone else would like to add anything.
Yeah. I think it would be great. Any additions? I know that Pasadena's really offered a lot of services and support. I don't know Mr. Carmona or Mr. Bravo Kareem, if you want to just highlight a few of those. Or I know you gave a very a very detailed response, Dr. Gilchick. So thanks so much for that. But there might be more specific information about Pasadena and Altadena.
Yeah, Dr. Gilchick just really touching all the most important points. But I did want to add that, many times we get, in dealing with this uncertainty as adults, sometimes we don't give ourselves the opportunity to validate our own feelings and to express those feelings. And, when I talk to my team who's responded to this disaster, I talk about building a deep bench, meaning that we need to have partners and teammates that we can call upon to share how we're feeling and making sure that we're processing, giving ourselves time to process. Because, as Dr. Gilchick noted, you really want to pay attention to how your child is expressing their emotions. So if they're feeling sad, anxious, or frightened, really creating space to encourage and validate their feelings. And sometimes if we're not taking care of ourselves, then it can be difficult to take care of others, including our own children. In Pasadena, we rely on the LA County Department of Mental Health services. And so all the resources that Dr. Gilchick provided are where we refer our families to as well.
Yeah, thanks so much. It's so important to, just remind ourselves as adults that we do need to acknowledge what we're going through as well.
Yeah, and I'll just add at Pasadena Unified, we have a robust mental health system with mental health professionals, licensed clinical social workers, school-based mental health providers, trained staff. In the initial weeks of the fire, we received a lot of support from other school districts, from the Los Angeles County Office of Education, community-based organizations, because we knew that there was going to be a lot that our students and our staff were going through. Many lost their homes, many were displaced, many lost their schools, which is a second home for many of them. And we also knew that that trauma wouldn't manifest itself all at the same time for people. Sometimes it would be right after the fire, sometimes weeks and months later. And so for us, of course, we want students to learn how to read and write, but we also, one of our highest priorities is, of course, their social and emotional well-being and their mental health. And so that is why we continue to prioritize those mental health supports for our students and for our staff.
Yeah, thanks so much for that. And, I know I'm grateful that there are a lot of services and support. I think we're very blessed in this county to have so many services and support. And I encourage people to just reach out and use the services. We have time for one last question. I'm going to actually ask Dr. Ragnan. I think this might be an important question to close on. And I think, Cyrus, you have a lot of experience from previous fires in other parts of the county that you can draw on to answer this. What's being done to prevent this type of massive fire from happening in the future? Wildfires are a public health issue, and how do public health experts suggest we be better prepared to prevent these disasters from happening? So I'm gonna let you close this out.
Okay, sure. That's obviously this is a question we could spend a whole hour answering, but I'll give you sort of the brief overview from the public health perspective. California is a very interesting state in the fact that we have a lot of our homes that are built near what's called the wildland urban interface, which means that when you look at areas that have lots of trees and forests, we have a lot of homes that are very close to them. So when wildfires break out, we tend to have neighborhood fires as well. And so that is a reality in California. About 5 million homes in California are that sort of fit that profile. So we know that the risks are always going to be there, and wildfires have been increasing quite significantly over the past couple of decades that not only affect just the forest areas, but also our homes and neighborhoods. This is the largest fire that
you may need to speak up because you're fading.
Oh, sorry. I think we all are aware that these fires are the largest fires that we've faced in Los Angeles County. So it's going to take quite a long time to recover from this. I can definitely attest that all of the agencies, and especially LA County Department of Public Health, are doing everything to their maximum ability to try to restore a sense of normalcy all over LA County. But it is going to be a long road. And in terms of prevention, yes, that is the number one thing that we are we are hoping that we can learn from this incident. That there are a number of factors that play into this. Of course, there's huge factors like climate change that affect our general risk in terms of whether or not these fires are going to break out. But there are some local measures that we can take in the face of that. For example, our power companies are reviewing ways that they can ensure that when we have high wind events, that they shut off certain sectors of the power grid or power lines, so that if those power lines are affected by the winds and get knocked over, that we don't have live wires that may then eventually cause a fire. So it's things like that our utility companies and the Department of Public Works and various other entities such as that are working to try to make sure that we know that these things are coming. We know high wind events are coming. We know we have excessive dryness and drought, and to do all the things that we can to try to ameliorate those circumstances. In addition, I think we always have to make sure that we are heeding all possible warnings that may come from our first responders, our fire departments, et cetera. And if they say, you know what, there's a lot of winds happening and we want people to get out because there are some fires that have started remotely from you, may not affect you yet, but may affect you soon, and they say get out, get out. Make sure that you are heeding all those warnings from all first responder officials to make sure that if they do, if fires do break out, and even if they're far away from you, that you can prevent potential death and loss from occurring in your area by listening to those warnings. So yeah, these are things that take a multi-agency and really level approach from the federal government all the way down to the local government to try to see what we can do to try to prevent these. But some things are going to take a very long time and will take very sweeping measures that are probably going to be necessary at both the federal and state level to try to get us to where we need to be to prevent these wildfires from occurring.
Yeah, thank you so much. I want to really appreciate all of you who were able to join us tonight. We're grateful that you spent some time with us. We hope we helped answer some of your questions. We do take the questions that we didn't get to tonight and try to add the responses on the frequently asked questions. And again, I'm going to urge you, specific questions that you may have for the Army Corps has a line set up where you can call. They'll also be at our town hall tomorrow night. So feel free to join us. That's at 6 o'clock tomorrow night on the same channels you're on tonight. But we will try to be as responsive as possible. I'm particularly grateful to our panelists for joining us tonight. Thank you, Mr. Carmona, Mr. Bravo, Karimi, Dr. Ragnan, Dr. Quick, Dr. Gilchick. It was great to spend some time with you. I appreciate all you're doing to help all of our residents and our workers be able to rebuild and get back to the communities that they love. So thanks, everyone. Have a good evening. And we'll, again, send us your questions and we'll respond. So good evening, everyone.